city of Costa Mesa today in California to visit the offices of Experian Health, part of the global information services company Experian. We're talking about how US health providers need to connect with consumers much more effectively, using data that can predict health conditions and help create much more relevant messaging. I'm Sarah Lockett. Welcome to the Business Debate. With me now is the president of Experian Health, Jennifer Schultz. Thanks for joining us on the Business Debate.
It's great to be here.
So, would you say that healthcare, in terms of the customer experience, has really lagged behind other industries?
Yeah, I mean, on the clinical side of the U.S. healthcare system, I think we have a very strong customer or patient experience. The problem is the clinical side isn't the only part of U.S. healthcare. There's the financial and administrative parts. The use of technology in healthcare is actually pretty slim. And so when a consumer in a retail experience or a financial service experience uses their mobile device or their online, that experience doesn't translate into healthcare. We still have faxes, we have a lot of use of paper. So there is a lot of room for improvement. We at Experian Health are very focused on improving the transparency of healthcare from a financial perspective. We've launched things like patient estimators. There's no other large purchase you make in your life that you don't know what you're about to buy. In healthcare, most part, that's all after the transaction. And so you really need that transparency in healthcare, and I think the use of technology can do that.
So how fragmented or siloed is the US system? Would you say that providers know at all what other kind of treatment or procedures you've had at other hospitals?
The system is extremely fragmented. You as a consumer or a patient are responsible for knowing what you've had at different locations. Think about that from an individual perspective where you're a 60-year-old and you've had 60 years of care. It's very hard for you to actually remember that. The other issue is identity isn't the same when you go from system to system. Every hospital, every provider looks at you, Sarah, as an individual and puts a number associated with you. That number is within their system only. And so you may go across systems, but there is no view of identity. One of the solutions we've launched here at Experian is the Universal Identity Manager, and we're offering that with no charge to our clients because we think identity is the one key to provide transparency across systems.
So this unique patient identifier, what are the barriers to people using that?
So right now the barriers are really system-wide, and so it's technology. We're offering it out, and now systems are adopting it. We've got 40 clients on it today, and that number is growing. We just launched this last year. The reality, though, is that it has to get embedded into the system and it has to have universal use. We also recently partnered with the NCPDP, which is the standard body in pharmacy. And so the pharmacies are now adopting the use of universal identity. If you think about healthcare, it's not just the hospitals, it's not just the physicians, but it's the pharmacies, it's the labs, it's all of those ancillary services associated with healthcare that have to have the same view of who Sarah is or who Jennifer is.
So how good could all of this be if data was shared? What is the vision?
So the vision is it is going to be better. So you would have the ability to understand where your data exists. You'd be able to understand how to compile that information, know where all your records are. We're a long way off on that, right? This identity is a foundational piece, and that will allow hospitals and providers and pharmacies to get to it. We need to start the journey today so that eventually we can get to a point where you are Sarah no matter where you go within the U.S. healthcare system.
So 25 to 30% of health bills are never paid, and how would this help with that?
If you ended up having a clinical experience at a hospital and then got a bill for $100,000 and you're on a tight budget, that would be shocking to you and you probably would be overwhelmed by it. If you know up front that you were going to have a $100,000 bill, perhaps you can talk with the hospital or the provider about their charity programs, their payment plans. You can set it up. We know that consumers today want to pay their bills, but it's that after the fact shock that is in many ways preventing them. And the capability to control that and remove the shock, we think that gives patients the control, and we think it'll improve that payment ratio as well.
So it all sounds great, but how convinced are healthcare providers about these arguments? Because it is a big investment and a big shift for them.
They're convinced because it is now hitting their bottom line. Think about it, as consumers have higher deductibles, and that means they are responsible for more of the payment. The providers know that the consumers have to be a key part of the revenue stream for them. And so they've got to engage that patient. They've got to make sure that patient understands what they're obligated to pay, and then provide the mechanisms for that payment. We have a patient portal that allows patients to set up payment plans and pay online.
So the plan is to actively suggest or push treatments or options to customers. And do they want to actually have maybe adverts for hip replacements pushed at them on social media?
So it's really interesting because you're heading towards the clinical side. I think what you're going to start seeing is active use of this data around the financial and administrative side. So think of it as reminding you that you have an appointment through a text message, or reminding you that you haven't fulfilled your prescription, which your doctor wants you to take so that you keep your blood pressure low. On the clinical side, there are use cases for it, but where we see our clients moving more actively is the use of technology on the financial and administrative sides.
And what is the timescale for all of this happening realistically?
I think it's happening now, but it will take 10 years for this industry to get to a universal identity. It will take 10 years for patients to be able to aggregate that information. But I believe what you're seeing is pockets of it happening today, and then it will roll out.
Well, Jennifer Schultz, thank you very much.
Thank you very much.